Great. So while we're waiting for a few more people to log in, I would like to again extend a very warm welcome to everyone. We're really excited to see you all here. Um, and so as a brief overview, this is another Our Humanity Town Hall run by URU. We are here as a resource for our community to help combat misinformation, connect you to amazing doctors like our wonderful guests this evening. And our goal is to give you an opportunity to connect, not just with our doctors, but also with each other in this really difficult time during the pandemic. So active participation is definitely encouraged, whichever platform you're viewing this from. So if you're in Zoom, please utilize the chat box feature. If you're not familiar with Zoom, it's down at the bottom of your screen. It's a little speech bubble. You can also raise your hand, and our tech team will try to keep an eye on things to make sure that we answer any questions. So to raise your hand, if you go to the reactions button, it's a little smiley face at the bottom of your screen. You can raise your hand that way. We'll click on you and just make sure that you're unmuted before you start to ask your question. And also please make sure you stay muted when you're not speaking if you're on Zoom to avoid any background noise and feedback issues. And so before I introduce our guests, we're going to do our customary introductory poll. So Jason, if you could launch that for us, if everyone could take just a couple of minutes to fill out these questions. This is just information that's going to help us to serve you better in the community. And it's really for internal uses only. So if you could take a few moments to fill that out.
Molly, are you able to start the poll?
Yeah, it should be up there. Can everyone see it?
Yep.
Perfect.
Okay, so a couple more minutes and we will close that out so we can get things started. Right, I think we are hitting critical mass with our responses. So if you could take a couple minutes to finish up and we will begin our town hall. All set, Jason and Molly? Okay, awesome. Thank you so much. All right, so as we usually do, we have our wonderful fitness expert, Abel from Revamp Fit, and he is going to take us through our warm-up. Please, we encourage you to participate. This helps to ground us in the moment, helps us to shake off our day, and it's a lot of fun. So whether you're sitting or standing, I encourage you to join us, even if you feel a little silly. It's okay. It's all part of the experience. Abel, I'm going to hand it over to you. Take it away.
All right. Thanks for that, Carmen, for sure. All right, guys, I'm just setting up the music real quick. Let's see. Cool. All right, you guys. Well, thank you so much first and foremost for having me and for you guys joining along. We're going to be doing some movements, so if you haven't done these movements with me, my name is Abel from Revamp Fit, and I'm here just to take a few minutes just to kind of, loosen up and create some blood flow with your body. So I have a bench right here. So if you have a chair that you're sitting on, you can even do your chair exercises. The whole purpose is just to get you up and moving, okay? So first thing up, I want to get a chance to loosen up the legs. So we'll start off with the ankles, and we're just going to do simple ankle rolls, just like this. You can hold on to something if you're doing a standing. If you are seated, same exact thing, just rolling your ankles, right? Most likely they're tight from, not moving, right? So we'll just roll them around. Okay, we'll just go for a few more seconds because we have the whole body to quickly go over. All right, let's go to the next ankle, just loosen it up. All right, perfect. Keep rolling it. All right. All right, guys. Our next area that we're going to loosen up will be the hamstrings, right? Very important area. If you have any knee pain or knee tightness, this one is a blessing to do. So I'm going to show you guys the standing one first. So what we're going to do is just kind of do some foot taps like this, kind of like jogging in place. And then what we're going to do is we're going to kick one leg out in front of us, push our hips back, and do like this scooping motion while keeping that leg straight. We should feel a nice stretch right here. And then we're gonna go opposite leg, push the hips back, and repeat. So if you were wondering how you could do it from a seated position, same thing, just get your blood flow going. One leg forward, and you're gonna bend from the waist. And you're gonna pretend like you're scooping something. You should feel, if you're doing it right, you'll feel a stretch in the back of the leg. Again, scoop. You don't have to bend super low. If you're bending from the waist, I feel it even when I'm doing it right here, right? So shoulders together and scoop. Okay, let's keep on knocking it out. We'll go for 10 more seconds. 10, 9, 8, 7, 6, 5, 4, and good job, you guys. All right, guys. Our next one, I actually want to do only a seated one because I think it's an important one for your outside hips, right? That's going to loosen up your lower back as well. We're going to go ahead and practice bringing one leg up, right? And we're going to place it on top of the other leg, right? If you want to make it easier, all you have to do is just bring the other foot back a little bit more so it's lower. When it's lower, it's a little bit easier, okay? So from here, we're just going to kind of lean forward and lean back. That's all we're doing. Just leaning forward and leaning back. You should feel a nice deep stretch right here. Leaning forward and back. Okay? Forward and back. All right? And you can kind of tell which leg is more flexible from the way, if your leg is like this right now, that means we have some work to do for the flexibility. All right? Our goal is to get it nice and flat. We'll do it one more time, and we're going to hold it for 10 seconds. Come right here, hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2. All right, guys. Now we're going to switch. Chances are you probably did the easier leg, right? That's what I did. We're going to do the other leg. You can kind of tell how high it is, right? And we're going to do the same thing, lean forward and come back. Lean forward, come back. If you've been sitting majority of the day, you're probably going to feel this stretch, right? Go forward and back. All right, forward and back. And we're going to hold the last one for 10 seconds. All right, so we'll go for another 10, 9, 8, 7, 6, 5, 4, 2. All right, guys, good job. So I've done 2 seated movements. I'm going to get up and moving for the next one. We're going to practice doing some normal twisting. So legs spread out, and we're just twisting and swinging one arm behind. So it's a lower back movement, but it's also a good movement for the shoulders, just swinging and pivoting, okay? If you want to still do a seated, the same thing, right? Just swinging. You can even drop your knees just to kind of work on your hips, right? So it's totally up to you. For myself, I'm definitely going to do a standing for this one. Just swinging around, and we'll go for 10, 9, 8, 7, 6, 5, 4. Good job, guys. Let's add a little bit more side to it. Let's go 1.5 side bends. We'll go 1.5, just like that. 1.5. Get a nice little stretch. 1.5. Right, feels good. 1.5. We'll do it for 10 more seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2. All right, guys, we're almost done. So we have the upper body to work on now. We're going to go ahead and have our elbows out right here. We're going to do some wide shoulder shrugs like this. Shoulders up and back, right? Shoulders up and back. Good. Now let's close them in a little bit tighter. And now let's do shoulder shrugs with the arms next to each other. Good. Let's now reverse. Let's go the opposite way. Let's go forward. Okay, keep going. All right, guys, now let's take care of the upper neck area. So we're gonna do some small head rolls and we'll add more range of motion. So I'm gonna start off small, right? Start off small, just doing some simple head rolls, drawing a circle with your nose. Every single rep, you can make it a bigger, a wider circle. Good. Let's go the opposite way now, guys. Loosen up. And we'll do this for our last movement right here. We'll go for 10, 9, 8, 7, 6, 5, 4, 3. All right, you guys. Well, thank you so much for having me and moving with me. I hope you feel a little bit better and a little bit looser. Again, all these can be done at any point throughout your day. I would suggest and recommend it. And until then, I'll see you guys next time. All right, enjoy the rest of the town hall.
Thank you so much, Abel. That was awesome. As always, one of my favorite parts of my week. I hope that you guys enjoy that as much as I do. I know that our team always has a great time when Abel is here to do some warm-ups with us.
I appreciate that. Thank you, Carmen. Thank you, guys.
Of course. Have a good one. Thank you so much, Abel.
Yeah, absolutely.
All right. So without further ado, tonight we are very excited to welcome two wonderful guests. This evening we have with us Dr. Ellis. Dr. Ellis grew up in New Haven and Hamden, Connecticut. She's one of only 5 African-American female board-certified cardiothoracic surgeons in the country, and she is the chief of cardiothoracic surgery at Bellevue Hospital. So very impressive there. She attended Yale University as an undergraduate and earned her MD from Jefferson Medical College. And currently, Dr. Ellis is a clinical associate professor in the Department of Cardiothoracic Surgery at NYU Grossman School. So Dr. Ellis, thank you so much for being here with us. We are very, very excited to have you.
Well, thank you for having me. I appreciate it.
Of course. And our second guest this evening is Dr. Nikki Waddell. Dr. Waddell is originally from Charlotte, North Carolina. She completed her undergraduate degree at the University of North Carolina, Chapel Hill with a BS in mathematics. She then attended medical school at the Brody School of Medicine at East Carolina University, and her internal medicine residency was completed at Eastern Virginia Medical School. Dr. Waddell is board certified in internal medicine and has extensive experience in both inpatient medicine and as a hospitalist and outpatient primary care. Dr. Waddell is currently a member of the Luton Medical Group and the owner of Kingston Internal Medicine in Alexandria, Virginia, where she provides patient-centered primary care focused on disease prevention. Dr. Waddell's focus is on disease prevention, and she strives to transform our healthcare delivery system from reactive to proactive. So thank you so much, Dr. Waddell, for being here with us this evening as well.
Thank you.
So to start us off, Dr. Ellis and Dr. Waddell, we would love to discuss a little bit with you both some COVID-19 updates. What are you seeing in your fields, in your practices? And what about sort of the vaccine, COVID-19, the new variants? What is something that you believe is very important to share with our community members? Dr. Ellis, if you'd like to go first, and then Dr. Waddell, if you want to jump in there.
All right, well, I'm going to be pretty harsh then. There are some people who are saying, oh, I don't want the vaccine. I'll wait for the shot. I'll do this, I'll do that, I'll do the other. Well, here are a couple of things. One is if you don't take the shot and you have kids, please make sure you have enough life insurance for them to be able to go to college and for them to be taken care of, because if you get COVID, you might not be here. We don't know. I mean, that's what's so frustrating and so scary about COVID. It can be nothing. It could be a minor flu. It could kill you. And believe it or not, it's actually kind of worse if it really just makes you so sick that you can't work anymore. You can't function anymore with the brain fog and these other issues, because then not only are you not bringing in an income to your family, but you are also still costing money. So I had a person in my hospital that didn't want the vaccine. And I said, well, that's fine. Your kid is 9 years old, you need about $3 million worth of life insurance. And so they should be, then you really need a couple $1 million worth of life insurance. And that'll probably cost you about $100 a month. And then for your disability, he said, well, I have disability through the hospital. I said, yeah, that's not going to be good enough. So you're going to need your own policy. So that's another, $75 a month. So he now has had the vaccine. This is no joke. This is not Tuskegee. This is not the paint scandal in Hopkins in 1999 to 2005. This is real. Get the shot when you get it, when it's your turn, or make sure you have other plans for your family to take, somebody to take care of your family.
Dr. Waddell.
Well said, Dr. Ellis. Things that I'm seeing in the community, I'm actually in the DC metro area. So I live in DC, I work in Alexandria. So the good thing about where I am is that people, I think in this area, more so than some areas, are trying to follow the guidelines. People are wearing masks. We have a lot more demand in this area than we do have supply. So most of what I'm saying is people who want to get the vaccine, but have not been able to get it because the demand is just so much higher than the supply. So in that, I think that's a great thing. I think that it's great that people in the community are buying into the vaccine and they want to get it. I do have some patients that are have some reservations and some questions, and I try to meet people where they are. I do think that there's been definitely a lot of misinformation, and I think that this whole thing has been politicized. So some people feel like it's difficult for them to make a decision about what's best for their health. But I agree. I tell people that it's really like playing a game of Russian roulette. I mean, you really just don't know, how the virus is going to affect you. I have several patients who are considered long haulers in that they've been infected and they're still very sick. I've had lots of people who've lost loved ones to COVID. It's very difficult. We always survey our patients and we ask, how's your family? Is everybody okay? I mean, I see, lots of patients every day and I'm asking this question, and it's very difficult to, because most of our patients have been touched by COVID in a very profound way where they've lost several family members to COVID. So I do think it's really important for people to get the vaccine. I also think that, that the fact that the vaccine is being offered in mass, the vaccine is free. I reiterate to my patients that you want to get the vaccine now while it's available to you. It is at no cost to you. I tell my patients, like, this is not how they roll out most vaccines like this. So I was like, it's really important for you to get it. So get it now while you can.
Can I throw in one other thing? I told my people not to be picky, because I had this one guy, he's like, oh, I'm going to wait till the Johnson & Johnson because I want the one shot. And it's like, all right, in my place at Bellevue Hospital, for you to get the Johnson & Johnson, you have to be pretty much mentally ill and or homeless and a drug user, because we're saving those for people that we don't think we'll be able to capture for the second shot. And we have so few of those, it's really much less. So no, sorry, you have to get the second shot. Put on your big girl and big boy pants and sign up.
I think when you bring up the fact, that people are considering, oh, this vaccine, that vaccine, should I get, this one or that one? I think that's come up a couple of times in our town halls as well. And I would love if you could speak to that a little bit more, because I think, especially right now, something that comes up often, we're hearing a lot about efficacy. And I think the term is thrown around a lot in relationship to the vaccines, but a lot of times it's not really explained what that means. And one doctor that we had on said it really well. There's no such thing as a second class vaccine. And it was interesting, Dr. Ellis, that you were saying some people had said, oh, I want Johnson and Johnson because it's one and done. And I've heard the flip side of other people saying, well, oh, I'm not sure about Johnson and Johnson. So could you talk to us a little bit about sort of like, what does efficacy mean? What is the difference really, other than, 2 shots with Pfizer and Moderna and 1 shot with Johnson and Johnson? Dr. Ellis or Dr. Waddell, whoever would like to.
My experience in this area is a little different in that, like in DC, they're actually giving people a choice. So I do get this question quite often. In some places, they're giving people a choice. I'm hands down telling people, whatever shot you can get, please get that shot. If it becomes available to you, especially in this area, because the demand is just outpacing the supply so much, that if someone has an opportunity to get the shot, I think it's important for them to get it. Efficacy just means how well the vaccine works against whatever disease it's trying to prevent. And there is a difference in the efficacies of the vaccines, but I think the main point is that all the vaccines decrease hospitalizations. It's 100% no hospitalizations, 100% no deaths with all 3 of the vaccines, which I think that's an endpoint that's really important to consider, because we want to decrease hospitalizations. We want to minimize death in this. So, I tell my patients, like, hey, all these vaccines are good. When people ask me specifically which one they should choose, I do tell my patients that the Pfizer and Moderna are more efficacious. So I do encourage my patients who have multiple medical problems and are high risk to get the Pfizer or the Moderna if they can get one of those if they have the choice. And when patients ask me about Johnson and Johnson, I think that, I tell them that vaccine is fine, but if you have the choice, if you have more medical problems, then for me, I would tell my patients to opt for Pfizer or Moderna if they could. But in many places, people don't have an option. Like, you can't choose which vaccine. We just happen to be in an area where when you go online, they actually ask you which one you want.
And I was just looking at the chat. Once somebody was asking about worrying about the vaccine causing a stroke, causing a blood clot, and they already had a stroke. It's like, actually, it's the other way around. COVID is a vascular disease, and COVID is much more likely to cause a stroke or other vascular. We don't quite know exactly how it's attacking absolutely everything, but if you've already had a vascular incidence like a stroke, COVID is so much more deadly for you. And it's also so much more deadly for our brown and Black population. We are more likely to have obesity and being overweight, more likely to have some diabetes and high blood pressure. And that is why we are disproportionately affected by COVID. With that being the case, if we need to be disproportionately taking the shot. And one of the frustrating things, and you're talking about being DC. In DC, they were sending the shots to Ward 8, and the people in Ward 2, which Foggy Bottom and Georgetown, were going to Ward 8 to get the shot.
Absolutely, I saw that firsthand. I literally, I live in Ward 8, so I live in Southeast DC, and I'm telling you, I've never seen anything like this. I took my mother to get the shot, and there were 200 people who do not live in the neighborhood standing in a line trying to get the shot for people who don't show up for their appointments. Literally, people camping out in the grocery store with lawn chairs, lining all the way around the grocery store. So, even when I went and got my shot, I got my shot in my community, and it was the same thing.
I do understand the questions though. I mean, Tuskegee was a horrible thing. If you looked at some of the other, into the 70s and 80s, some med students thought that Black and brown people had thicker skin and so had less pain.
Mhm.
It is still a healthcare disparity where a boy who was 14-year-old boy was in a bad neighborhood and got a bullet wound to the leg. And when the physician showed up, they said, "Why have you given this boy pain medicine?" And it's like, well, it didn't look like it hurt that much. And it's like, he is a child and you are torturing a child. Well, he didn't look like a child. He's a big boy. He is 6 feet, but he is a child. So all of these healthcare disparities exist. That is so true. But that doesn't give you the excuse to hurt yourself. We need to fight for our care, and we need to fight for these things to be fair and whatnot. But this is one that we are hurting ourselves by not taking this.
I completely agree. And I think something that's really important to remember that other doctors have brought up in past town halls is that in a lot of those other situations that you mentioned, like with Tuskegee, people didn't have a choice to be treated. And that is where so much of, the issue lies. And right now we do have the choice, and we do have doctors working on the front lines. We have doctors who have worked on the vaccines themselves, who have been there as a checkpoint to make sure that it's safe, to make sure that it's good, and to make sure that it's efficacious. I echo what you're saying for sure.
I was going to respond to the other.
Sure. I was actually about to prompt it, because I think you'd be the perfect person to answer this question.
About the aspirin.
Mm-hmm.
We are really figuring this out. And so I don't want to say yes, because, at one point we thought Plaquenil was going to work. Well, we don't anymore. And then at one point we thought the monoclonal antibodies were going to work, but now we're actually finding that an antibody cocktail is actually better. So anticoagulation, dexamethasone, or steroids and whatnot, these things are changing quickly enough that it is worth going to if you're in the hospital, they will look at the risks to benefits. And it's also a little bit more complicated because, aspirin, there is a reason why there really isn't aspirin for babies. We call it baby aspirin, but that really is for adults. I mean, so because there are some diseases that kids can get. So it is not such an easy question about low dose aspirin. And also aspirin is a fascinating medicine. If they tried to make it today, it would never get by the FDA. It is really pretty complicated. It's a different drug at low dose, medium dose, high dose. They still don't know exactly all the things it does or how it works. So I don't want to make a statement on, aspirin in this other complicated issue of COVID, especially if the patient's on steroids and other treatments.
Thank you. I think that is, thank you for addressing that question. I think that it's definitely complicated. So one thing that we definitely want to talk about this evening, especially since, we've talked about the vaccine, more people are getting the vaccine. What are some protocols that, people need to follow? I think we've been waiting for so long for this vaccine to come out. We've been waiting for so long for it to be our turn to get the vaccine, depending on where you are, how the rollout is going. But once you get the vaccine, what are the protocols for after you get your first dose of Pfizer or Moderna, and then your second dose of Pfizer, or Moderna, and then, or if you get the single dose of J&J? We've talked so much about what to do beforehand, what to do, to try to get the vaccine, but what happens after? I think that's a really integral part of the conversation that we, should really be having in our communities right now.
I mean, there's a difference between what you can do and what you should do. I think it's really important to highlight with this question. The CDC they've come out with recommendations on what you can do safely after your first shot. You're supposed to do the same thing. You're supposed to continue to wear your mask, continue to social distance, continue to minimize, being in crowds. So your lifestyle shouldn't change after you get the first dose of the 2-shot vaccines. Now, after you get the second dose, you still should maintain those same public health protocols, because it takes a couple weeks before you develop the antibodies. And so and with the one dose shots, you wait a couple weeks, so you still follow those same protocols before you make any changes. So I'm a little bit hesitant to tell my patients, oh, it's okay for you to gather up to a certain amount, and it's okay for you to travel. Although they're saying, after you develop the antibodies, you waited 2 weeks, that you can socialize with people without a mask who've also been vaccinated, and or people who are in the same household who are low risk, and keeping those numbers down. But I think that people should continue to wear their masks, should continue to follow the same protocols, because we still have not vaccinated enough people, to make these changes. And I do fear that if people start frolicking too much, that, we're going to find ourselves back in the same place that we started. Because the more people who get infected, the more you have variants too. Like, people don't understand that too. Like, the more that it spreads, the more we have this issue where we have mutations and things. So I mean, that's my take on it. I think people should continue to follow the same guidelines until more people have been vaccinated.
Yeah, I've been vaccinated and I've gotten both shots, and I'm well beyond 2 weeks for my second shot. And I still wear a mask in public, and I still give the stink eye to people I see on the street without it. And some of it is being a good citizen, providing a good example. When somebody's walking by me, I don't want to guess, are they vaccinated or are they just being a jerk? And so I think we need to be good examples. And one of the really quiet things that people really haven't been talking about is how much less flu we had this year. And I'm not saying that COVID was worth it, but think about the last time you had a cold. And that was because we finally learned how to wash our hands and wear a mask. We also learned how to stay home if you were sick. It used to be you go to the office and there would be somebody who would be coughing up a lung going, oh, I'm too important to stay home. And everybody's kind of going, you're just going to make us sick. Now we actually understand when you need to stay home and you need to take care of other people and you need to be considerate. So I just saw something coming up. I also agree that I think we're going to be wearing masks for a while. I mean, even the movie theaters are opening up. If I'm going, which is not quite yet, but soon, I could see me going in there, getting my popcorn, but having my mask on me, and then, slipping a little popcorn in there, and just a certain level of comfort.
Yeah, I'm in primary care, so I'm the first line of defense against the flu. And I will tell you, we have had 0 cases of the flu. This has never happened in my whole entire career. I've never seen this. Nobody's tested positive. We haven't had any patients who reported that they had influenza, which I think I agree with you. I'm telling my patients this all the time. I'm like, but let's talk about how we don't have any flu, And I think that goes that speaks to how powerful these public health measures really are. And we really probably have only about 50% of patients, 50% of the population that's compliant with these public health measures. And just with that 50%, we've pretty much eradicated influenza, which I think, to me, we have the answer to our questions right in front of us. Like, I've heard people sort of talking about, I read a great article, and I think it was in Atlantic, but, should we continue to do these measures during cold and flu season to decrease the amount of flu-related deaths? And I say, yes, we should.
Oh, yeah.
Absolutely. Like, if you're not having any flu-related deaths and all you have to do is wear a mask and social distance in order to prevent one person, even if it's just one person, I think I think it's amazing to me. Like, I'm just astonished at the fact that I haven't seen anybody with the flu. And I think I can count on how many people I've seen come in with a cold. It's just been amazing. So.
Yeah, so definitely keeping up with those practices is very important because it's true there has been a lot less flu, and a lot of times that is one of the leading causes of death, especially for older and younger populations. During like the flu season, you see so many people coming in and being hospitalized, so it is pretty insane that these small measures, the answers have been there all along. Um so one thing that's come up in a couple of conversations that we've had with community members, is a question that, um, regarding, once you are vaccinated, is it possible to be a carrier of COVID? And I think that is
Ah,
also linked to some of these conversations about, even if you're vaccinated, you should still be wearing a mask because
because
if
we,
that is the case, you could become someone who's spreading COVID to other people. So then going back to, community, the community responsibility, could either of you speak to that? Like I said, we've had small conversations about it, but I would love to hear more from either Dr. Ellis or Dr. Waddell
well,
about
the
that.
short answer is we don't know yet, right? Because the vaccines haven't been out long enough and we don't have a big enough sample. Although just came out today, 4,000 people that have been vaccinated and were unable to get the disease. So we're unable at 90% efficacy. So they were unable to get the disease and unable to spread it. So that was one of the biggest concerns. So even though you're not getting sick, are you going to be a carrier and spreader, kind of like typhoid Mary, where she wiped out all these people by her cooking because she had typhoid and was giving it to all these people. It looks the early data, but this again is early. So the questions that we don't have the answer to. How long is this vaccine? How long are these antibodies going to last for the vaccine? If you do get COVID later, is it going to be easier on you? Are we successful in not being able to transmit it? We don't, again, this is a novel coronavirus that was called COVID-19 for a reason. It has only been there since 2019. We are barely in 2021. So until COVID-19 has its 10th birthday, its 20th birthday, and its 30th birthday, we're not going to know some of these things.
But I also think it's important to point out that you can get infected with COVID after you get your first shot. And again, this is why you need to, and you still can get infected with COVID, like after you've gotten these shots. And that's why it's important to, I mean, the chances of you getting it goes down, but it's not zero. And there have been cases of people having the shot and then testing positive. Now they may have been exposed before they got the shot, but again, it's important for people to follow these public health measures after you have gotten your first shot. Don't get your first shot and say, hey, I'm good, I don't need to wear my mask anymore. You want to wear it, and then even after you get your second shot, you want to still continue to follow these guidelines so that so in the event that you do get it, that you won't give it to someone else.
I think another question that's come up often is, now that there is a vaccine, do I still need to, get tested? What is the importance of still getting tested, even though a vaccine is out there? I think in a lot of cases, our focus has shifted from, getting people tested, making sure people are tested, contact tracing, all of that. And now it's shifted to, focusing more on getting people signed up to get the vaccine, getting people vaccinated. But we definitely shouldn't forget about testing. Can you speak to why it's important to still be tested, I guess, especially if you haven't been vaccinated yet, especially also if you think that you've been exposed?
Well, New York City Health and Hospitals Corporation, which I am part of, and that's Bellevue is the flagship hospital for that. Once all of us, so like my entire team, more than 50% of the hospital has been vaccinated. It's actually very interesting. Most of the docs have been vaccinated, the nurses and the nurse practitioners. When you go down some of the socioeconomic levels, those are the ones that we are having more trouble with housekeeping than we are with the residents and doctors, which is frustrating for us. But they still want us to be tested at least, they would prefer once a week, but they want it at least once a month. And that is for surveillance and to know about variants coming out. And New York City actually has a robust enough testing system. I don't know, we're very spoiled. I don't know about the DC system, and I don't know about the Connecticut system, but in New York City, you can walk in to my hospital as a person, not just as a doc, but you could, if you walked into Bellevue tomorrow, you might have to wait in line, probably about a half an hour, 45 minutes, but then you will get tested and the results will come back the day after tomorrow. And of that, we are doing the DNA sequencing of 10% of those so that we know what level of variance there is, and if there's anything, are we going to need a booster and all that kind of stuff. So the importance of it is, it's kind of like, why do firemen stay at the fire after the fire goes out? They stay there to make sure there aren't any hot spots, and if there are, to really just hose them down as quickly as possible. And that's the same thing with this surveillance testing.
I'll just echo, what she's saying is that in order for, especially on a federal level, for them to know like which communities, need the vaccine and where they're sending their resources, the testing is really important to track that. And it's disappointing that I've seen just nationally that testing is going down. We're getting tested at least once a month. And I'll just say that I have been very proud of DC in particular, even more so than Virginia and Maryland, because we're all kind of right here together. But you can get tested. Anybody can get tested. A DC resident, all you have to do is sign up, and you can walk up or drive up. So they're making testing very available to people, and you can get tested pretty much any day of the week, which I think is great. But it's important for people to continue to get tested, especially since you have a lot of people who still haven't been vaccinated, so that we can get the resources to the places that we need them. And as testing goes down, it's harder and harder for those people whose job is to predict where that needs to go. They need that information so they know, okay, well, we're lacking in this community, in this state, in this area, and they track all those things. So I would encourage people to continue to get tested. There are variants. So until we're out of this, I think testing is going to be a big part of getting on the other side of the pandemic. Now, there's somebody's asking a question about a cough.
Yes, I saw that in there. So I guess that would kind of go along the lines of, I guess, Dr. Waddell, what have you seen in maybe some of your patients as common side effects, after the first shot, or what might be something that someone should maybe be a little bit more concerned about? I know that when I was vaccinated, the first 48 hours, I felt really feverish, chills. I went to bed early, and then the next day I was feeling better. But I also know other people, and someone had put in the chat that there can be other symptoms that seem a little bit less common. So would you be able to speak to that at all?
Sure, I see this every day. I would say the COVID vaccine, to me, anecdotally, is sort of very similar to how COVID itself is, in that it's sort of all over the place. And people, you don't really know beforehand like what your reaction is going to be. So I have lots of people who get the vaccine and they have no reaction. They're like, I got the shot and I was completely fine. I have lots of patients who do have reactions to the vaccine, but the reactions literally span, it's a lot of different possibilities of what people kind of be sort of flu-like. So muscle aches, that's very common, that people just feel like they're wiped out, they're very tired. Usually this lasts 1 to 3 days. possibilities. But most of it is limiting, like self-limiting, like usually it lasts 1 to 3 days. It's not, most people don't have symptoms long-term. Most of the symptoms can be treated, just your symptoms with, Motrin, Tylenol, things like that. And, I don't have any patient that's still